Tonight, fighting the coronavirus worldwide, some 400 people have died from it. Here in the U.S., 11 cases have been confirmed, including one in nearby Boston. Connecticut hospitals and emergency personnel are taking all the precautions they possibly can. Channel 3 Eyewitness News reporter Susan Rapp is live outside Hartford Hospital for us tonight. Susan, what did you learn there today?
Well, we learned a lot. In fact, there are very similar circumstances when it comes to this particular virus and the flu, but they are not exactly the same. Now, the good news as far as Connecticut goes, we have had no confirmed cases of the coronavirus, but some worry that could change and we need to be protected.
So this is really what we're basically looking at here for the initial stuff. We got our gloves, gowns.
Those on the front line are often the most at risk. Emergency personnel take care of a lot of sick people, and they need protection. How concerned are you about the coronavirus?
Yeah, so we're definitely concerned. We want to make sure that everyone is protected and has the appropriate equipment to respond.
AMR in the Hartford region has 260 EMTs and paramedics. All of them are now being trained to be aware of the coronavirus and to wear protection. Symptoms of infection are similar to pneumonia and influenza. EMTs and paramedics are told to look for the presence of fever, symptoms of respiratory illness, and if someone has traveled within the past 14 days to Wuhan, China, Japan, and Thailand.
So he's going to put on his gown first.
Doctors and medical personnel at Hartford Healthcare are training their staff as well. Respirators keep out viral particles.
And as part of putting on his respirator, we've all been trained how to do what's called a fit test. And he's going to inhale and exhale and make sure there's no leakage of air around his respirator.
Hospitals have long dealt with other infectious diseases such as SARS, MERS, and even Ebola, and now the coronavirus.
We have a very brief travel screen that we do for every patient that comes in. The point of this is to, number one, keep the patients and their families safe, and number two, provide them with the most appropriate care as quickly as possible.
Protective gear is critical, and if doctors suspect that someone may have a contagious illness, one of the things that they do immediately is remove them from other people. Again, no confirmed cases of the coronavirus here in Connecticut, but as you saw here tonight, hospitals, EMTs, and paramedics are ready. We are live in Hartford. Susan Raff, Channel 3 Eyewitness News.
Okay, Susan, thank you.